So she looks at some universal prerequisites that everybody needs in order to be healthy. And she says these things are air, food, balance of activity and rest, solitude and social interactions. You need to have balance between being alone and being with other people. You need to have water. You need to have elimination and excrement, so like kidney and GI function. You need to have well-being and the prevention of hazards in your own life. And you need to have the desire to be normal, as she describes it. So you need to have the desire to be normal or healthy, as she describes it. So it is through these self-care requisites that people are healthy. And when you have a problem in one of these areas, that you have your self-care deficit. So if I have a problem in air, meaning I'm having some sort of respiratory issue, I would have a deficit in my respiratory system. Maybe I have asthma and I'm having asthma exacerbation. I would have a deficit in my air that the nurse would need to address. Maybe I'm having a deficit in my food. Maybe I'm malnourished, or I have excessive vitamin D, or I have high cholesterol, right? These are all things that can be linked back to nutrition. So then I would have a deficit in my food area of her. Maybe I'm having problems with my metabolic activity or sleeplessness or things like that. Then I would have a deficit within the area of activity and rest. And that can be true in all areas. So you can apply healthcare ideas and physiological processes to each of these, right? You can look at solitude and social interaction being related to mental health and psychological well-being, support networks within your life. Water, of course, we can understand about fluid and electrolyte balance, right? We can talk about hydration and dehydration with our patients. Elimination and excrement, so this would be any malfunctions of like the kidneys or the GI system, so that would make sense, right? There, we can talk about human well-being, the overall wellness and the sense of being we have, and prevention of hazards. So hazards here could be things like injury, right? So if I fell down and broke my leg, this would be a hazard, a deficit in that area. And then human functioning and the desire to be normal, where it's kind of like a catch-all, really. So anything that is like out of the normal for you can kind of fit into that category. So maybe I have a problem with my vision, right? So that's not specifically listed within her status, but maybe it affects my ability to be normal, per se, right? So like I had a lazy eye as a child, and then I have glasses, and because of my lazy eye, that would be considered abnormal. So nursing could help me to deal with my vision issues, right? They could teach me about the importance of wearing glasses, right, to fix my vision. So quite prescriptive of her idea of the self-care requisites and overcoming them, right? And if you were to choose this nursing model, you would want to look at like these self-care deficits as the function or the beginning place of understanding her model.